Hello, this is the lecture for antiviral medications from Lilley. So just as a quick recap on what a virus is, viruses are not actual cells, they are called virions, and they are basically just a virus and a protein. They cannot replicate on their own because they don't have a nucleus. They need to attach to and enter a host cell in order to replicate, and they use the host cell's energy to make viral proteins and their DNA or RNA, and this makes them difficult to kill because they actually are inside cells, so they can evade detection, and also because they're inside of a cell, drugs that kill viruses often kill the cell that the virus is in as well. So lots of challenges there. So there's two different types. There are antiviral drugs that kill virions, so kind of thinking similarly to bactericidal, or they suppress replication, which is like antibiotics, that would be bacteriostatic. So current antivirals are effective for mainly the following viruses, and there's always new things coming out, but at the time of your textbook and right now, cytomegalovirus, hepatitis viruses, and there are antiviral medications for B and C. Herpes viruses, so it would be HSV1, oral herpes, HSV2, genital herpes, and zoster or shingles. HIV, and those medications are called antiretroviral drugs. The flu or influenza A and B, and respiratory syncytial virus. There's my parentheses was missing there. So characteristics of antiviral medications is they need to be able to enter infected cells. They interfere with viral nucleic acid synthesis and or nucleic acid regulation. Some interfere with viruses binding to cells. Some drugs stimulate the body's own immune system. And drugs need to work synergistically with the patient's immune system. So if a patient doesn't have a competent immune system, then the antiviral drugs will not be able to work as well. So I'm just choosing some select antiviral drugs from your book. So I chose one or two for each of these categories. So acyclovir or Zoravax is a type of medicine that is used for HSV1, 2, and varicella or zoster. And I'm going to take them or leave them, but things that I think might be helpful to memorize these. So acyclovir is one of several different types of antiviral drugs, and it's kind of the prototype. And the way to think about that is acyclovir works on aggravating viral infections. So HSV1, 2, and zoster or shingles, all of those are painful and often itchy. And so think about that as when you have an itch, it's aggravating. And it's used for initial and current or recurrent infections. And this is just in case you haven't seen it before in a while, this is oral HSV, so oral, which is HSV1. And I don't have a picture of HSV2, but it's very similar, but it's on the genitals. And then this, as you can tell, is very similar. It has these fluid-filled vesicles, and this is shingles. And one thing, just because we're not talking about it, it's probably in your dermatologic disorders coming up soon, but just to kind of talk about it, shingles follows these nerve patterns. It's called dermatomes, and so you'll see them usually only on one side, but sometimes on both sides. But the vesicles will go along these kind of diagonal patterns that follow the nerve. Go back to the medicines, though. I'm sorry. Oh yeah, that's it. So when people have recurrent episodes, they need to start taking the medication as soon as possible, and it helps. The goal is for it to help the vesicles to blister and resolve sooner and with less pain. So with my little mnemonics, you might think of something that works better for you, but because NCLEX will be giving you the brand name and the generic name, or the trade name and the generic name, I use either one because they're going to give you both. So this one is for cytomegalovirus, and so I say cytovine works on CMV just because it's the only one in your book that starts with C. So it's just a way to kind of tie those together. So cytomegalovirus can be really minor. There are, I think, approximately 90% of people will have CMV at some point in their life by the time they're an older adult. And kids, I think about a third of small children have had it. When it's really a big problem, there's two different populations. So when people have had a transplant or immunocompromise, especially something like HIV, like serious immunocompromise, or transplant when they're on immunosuppressants, they can have a serious infection. The other thing that can happen is if a woman is pregnant and she gets CMV for the first time, it can lead to some very significant fetal anomalies. And so one of the things that can happen is microcephaly. And this little girl, this is Evelyn, she was born with congenital CMV. Her mom got CMV when she was pregnant. And so if you can see, she has a smaller head, and this is called microcephaly. There are cases that are much more extreme where the head, you might have seen it, if you might have heard of the Zika virus, which is more recent, that caused that too. And so it can cause a very small head on a baby. And unfortunately, some children do not survive. The tough part is it's pregnancy category D. So there's really nothing that can be done once a woman who's pregnant gets CMV. And so prevention is key in pregnancy. You don't need to go into a lot of detail about this, but I just wanted you to be able to know that unfortunately, one of the most serious risk factors, people can't take medicine for it because it can actually cause fetal abnormalities. The medication can as well. So it's really indicated for people with serious infections that are this category. So this just shows some of the symptoms that can happen. It can happen in numerous parts of the body. So it can cause encephalitis, which is confusion and neurological symptoms, meningitis, which is infection of the meninges in the brain or the spinal cord, retinitis in the retina of the eyes, pneumonia, transverse myelitis. Don't worry about the ones that are a little different. Prolonged cytopenia, so blood difficulties, and exacerbation of the disease in people that have idiopathic thrombocytopenia. So big thing to think about this is it can be many different manifestations, and a couple of these down here are that it can cause difficulty with blood cells. It can lead to death, and lastly on here, it can lead to colitis, so inflammation of the colon. The next medication we're going to talk about is Tamiflu, or oseltamivir and raxibacumab. And so Tamiflu and Relenza, they both, the way I think of this, R and T. Tamiflu and Relenza offer relief from the flu. So they're effective against influenza A and B. And this is an ad for Tamiflu. So this is when people, as you've all experienced, I'm sure, having the flu can be very debilitating, even if it's short-lived. And so their tagline here is there's no such thing as a little flu. And so it can reduce the duration of illness, but treatment should begin within 2 days of symptom onset. So it doesn't take away the flu, but it can shorten the duration and shorten the severity. Adverse effects are mainly gastrointestinal and sinusitis. Next we have ribavirin or Virazole. And so a way to remember this is ribavirin for RSV. So this is respiratory syncytial virus. And this can cause different symptoms. So in infants, it can cause irritability, poor feeding, which is obviously could be potentially dangerous in a little infant. Lethargy, pauses in breathing, and fever, which might not always be present. Part of that is young infants, their immune system is, and their body is not mature, and their immune system takes a while to fully develop. So this is something that can just look like a minor cold, but it could be something that could become more serious. Children and adults both have runny nose, cough, fever in kids, not so much of fever in adults. So varying symptoms that are all caused by the same virus. So it helps for RSV, but again, not for pregnant women. So it's not safe in pregnancy. It actually has a black box warning for teratogenic effects. And this is one that's kind of interesting because it can be, these effects can happen either from the sperm or the ova. So males and females who are treated with ribavirin should not conceive for 6 months after they complete treatment, because the medication can affect potential fetuses from conception for up to 6 months after they complete their therapy. So the people that have had this medication need to have 2 forms of birth control for 6 months after they complete. There's caution with pregnancy and with childbearing healthcare workers for this, because they can actually be affected by being exposed to the medication. So if a woman is pregnant or childbearing, they should not be around this medication. There's an inhaled route available for infants. And besides RSV, it's also indicated for hepatitis C treatment, and that's a combination treatment, but it's been very helpful for treating that. So I'm just going to give some really general information about hepatitis drugs, because new drugs are literally being developed all the time. There's new names, there's new types, and so I'm just going to talk about the general idea of them. So hepatitis C treatment is actually curative for the vast majority of patients, which is a new development. It used to be that it was a chronic illness that could lead to cirrhosis and death, and had a lot of morbidity. And these medications are very new, and they are curative for, I think it's 95% of people who complete treatment. It's amazing. So mechanism of action, there are different types. So nucleoside analog reverse transcriptase inhibition. We talked about reverse transcriptase inhibitors for HIV in class. So this works in a similar way, and basically what it means is it leads to a decreased ability for the virus to replicate. There's also RNA polymerase inhibition, which again inhibits replication, and protease inhibition, which even if the virus is able to replicate, this prevents it from actually forming into a new virion. So now we're going to switch over to HIV medications, and similar to hepatitis treatment, people need to be on multiple medications, and it needs to have very strict adherence. So that's why they call it highly active antiretroviral therapy, because people need to take it basically as much as possible, and they aim for 100% adherence to daily medicines. This used to be that it was several medications several times a day, but now there's a lot of combination medications, so it's not as difficult to adhere to. So a combination of 3 or more medications, but like I said, some of them are combined. I'm not an expert in HIV, but I have not heard of a single pill that has 3 different ones, but there's a lot that are 2 different medications in one, and they need to be at least 2 different classes. So you can't be on 3 medicines that all work in the same. So 3 different cycles or classes. So it needs to, for instance, there needs to be something that maybe reduces the ability to produce the DNA, and then also something that does a different action, like something that keeps the virus from being able to enter the cell. And because viruses can develop resistance, and it can have mutations, medications might need to be medication changes may be necessary because of resistance or the virus mutating. So we talked about this briefly in class, but I just wanted to go over it one more time. So the life cycle of HIV, just to give a little overview of it. So the virus goes to the cell and there's a co-receptor, the CCR5 co-receptor. So it actually has to connect to the CD4 cell and this co-receptor. And there is a medication that can inhibit, there's a class that can inhibit it attaching to that co-receptor. There's another medication that prevents fusion. So even if the two things happen, it prevents the virus from being able to enter the cell. And that's a fusion inhibitor. And then there's a CCR5 inhibitor. You don't need to memorize the names of the medications, but I want you to be able to think about what the classes are. And then after the virus enters the cell, there's reverse transcriptase because it's a retrovirus. So it goes from RNA and it unzips and then turns itself into DNA. And there are a couple different types of reverse transcriptase inhibitors. You don't need to get super in depth on this, but there are two different types. So there's nucleoside and there are non-nucleoside reverse transcriptase inhibitors, and those are just called NNRTI or NRTI. So a person can be on one of each of these and then an additional medicine, and that is enough for a lot of people for their treatment. There's also, back to the next phase. So reverse transcriptase inhibits the virus from being able to turn into DNA, which would need to happen for it to be able to go into the nucleus. And that is integrase. These are all, a lot of these depend on enzymes. So reverse transcriptase inhibits that enzyme. And then integrase is an enzyme that takes the viral DNA and actually integrates it into the human DNA. So it kind of splices itself in. So an integrase inhibitor inhibits that enzyme. And then it takes over the nucleus and it starts producing new virus. And then protease is where, so you have a way to think about this is there are new proteins, DNA strands that are made, but it's a long step. And then protease, the way I think about it, is kind of like scissors. So it actually breaks up into the individual aspects, the individual ingredients for an immature HIV virus, virion. And then it also has proteins that are needed, and I'm such a good artist here, but proteins that are needed. And so protease helps to divide these up. And so a protease inhibitor prevents that. And so if it's a long strand of DNA, it can't be divided into the individual products for new virus. So the protease is that assembly in the picture we looked at. And then once the virus has all the parts it needs, it goes to, and this is on this picture here, it goes to the edge of the cell with the individual parts and it buds off. So it steals a little piece of the CD4 membrane and it buds off. And then it matures. It has its own ingredients in there to mature. And so it has to be stopped at least 2 different parts of that cycle. I really want you to know the categories of drugs and knowing that there has to be at least 3 different medications from at least 2 different classes. So some selected drugs. I'm not going to have you memorize the specific drugs. So adverse effects vary. Serious adverse effects are impaired liver function, so elevated LFTs. So that would be things like ALT and AST, hepatomegaly. So really think about liver when you think about HIV drugs. Myopathy, so enlargement of the heart. Rhabdomyolysis, which is when the muscle tissue can break down and go into the kidneys and cause kidney failure, and lactic acidosis. There are many different drug interactions. So the key thing I would think about for HIV drugs is, like I said, knowing how many medications people need to be on, that you need to be monitoring their liver function, and that there are many interactions with medications, so you would need to check compatibility of things. So for any virus, we need to be focused on prevention if at all possible. And for HIV, there is pre-exposure prophylaxis, or the acronym for that is PrEP. And this is a combination of 2 reverse transcriptase inhibitors. And don't worry about the specific generic names because, again, things are changing all the time. But Truvada is a good name to remember. That's this combination. And this is given, it's a daily medication taken by people who are at very high risk for HIV. It's up to, your book said up to 90% effective, but this ad here actually says 92% effective. So with regular daily use, it is very effective. And just to kind of have an idea of who would be very high risk, from the CDC, there's actually a very clear algorithm for it. So a couple indications would be if somebody is sexually active and they have either had a bacterial STI in the last 6 months, if they have had multiple partners of unknown HIV status in the last 6 months, and they have not always used condoms, and if they have an HIV positive partner with a detectable viral load. Those would all be considered high risk. The CDC also recommends offering PrEP to people that are at substantially increased risk for acquiring HIV. So nursing applications for antiviral medications, we need to inform patients that antiviral drugs are not cures except for hepatitis C, that's really exciting because that gives hope that there are cures on the way for other viruses. But all these medications are really designed to help manage symptoms and to speed up recovery. So instruct to start therapy at the first sign of reoccurrence for genital or oral herpes or herpes zoster or shingles. So people will often have a PRN prescription at home, and then as soon as they see that coming back, they should start taking it. And that would be prescribed by their provider with a plan for that. And then the nurse needs to monitor for therapeutic effects. So things like monitoring viral load for HIV and hepatitis to make sure that things are going in the right direction and we're not developing resistance. And then looking for relief of symptoms such as crusting over of lesions, and always educate on prevention. I have a few study questions for you to guide you for studying for the exam. And if you have any questions, please feel free to reach out. Thank you.